Yes.
Okay.
I think one of the biggest concerns that we all have is the quality of medical and dental care in Thailand. And I wondered what your actual experience has been in both those areas.
Well,
You've had more experience in medical than me.
I have, yes. I have been to 2 hospitals here. Both are very good. I had sciatica down my leg, and I saw orthopaedic surgeon. He was very good, spoke English. The hospital was good, they could speak English, and I didn't even need an appointment. This is brilliant. You can just go into a hospital and they say you want to see an orthopaedic surgeon or a gynecologist, and they take a few particulars and off you go, and you can see them. Whereas at home, you have to go to your own doctor, you have a letter to take to the hospital, you can wait weeks and months.
Wait weeks and months to see somebody.
Yes, and then if you go and have treatment, even say an x-ray or something, you have to wait for the x-ray to come back. This is Britain. Here, we've been, and I had a problem, gynecological problem, and I went to see the gynecologist, and I had x-rays and a scan, everything all done straight away.
It's all done same morning, isn't it?
And the treatment I was given, just like that, in the same morning. That would never ever happen in Britain, and we think this is very good.
What I liked as well was the fact that when you had your x-rays and your scan, they even gave you a DVD to take home.
Yes.
As well as a written report from a radiologist.
Yes.
So,
yes.
and that came, you waited about half an hour.
Yeah,
they said, well, here's your report, here's a DVD, you might like to take these to your doctor.
Yes.
I thought,
this is amazing.
in Britain? You'd never get that.
No.
In Britain, you'd ring up your GP, your family doctor, after about 10 days, and they say, yeah, everything's fine. Whereas here you had a report, you could read it yourself, you could understand it.
Yes,
it was into layman's language, it was all explained.
Yes.
And how much did that episode cost?
That was pretty pricey. That cost at least 2,000 baht, which is about £40.
Say again?
About 2,000 baht or £40 for the X-ray, a scan, written report, and the DVD.
And you're weighed, when you go in you're weighed and you're measured and your blood pressure taken and all that sort of thing. And it's so lovely because if you do have a problem and it can be sorted out straight away, you haven't got to worry. Whereas at home in Britain, you think, well, is there a problem there? I've got to wait for all these results to come through, haven't you? And then you're worrying for weeks that you might have some horrible disease or something. Well, at least you know there and then. And
when you went to see the specialist, you had a good chat with him. Well, you said you've seen me in there a long time, anyway.
Forever.
Good chat. And the charge there for the specialist was 250 baht or £5.
Yes, it's very cheap.
And that was 20-30 minute consultation.
Yes, yes. You have to pay for your medicines. We had to go to
so you
the
had
pharmacy.
to pay for medicines, and I think if you get your medicines from the hospital, it's more expensive than if you go to a chemist. We've been told that.
But it's well worth just
going. It's not excessive.
While you're there, might as well get everything
It's
there
not excessive.
and then. Yes. No, we found medical things very good. In fact, this is partly why we came to Chiang Mai, in a way, because we knew it was quite good on the medical side.
We knew that's right. We'd heard there are a lot of good hospitals here. There are government hospitals as well. We've not tried them.
Well,
we're told they're cheaper, but we've only been to a couple of the private hospitals. There are about 4 or 5 private hospitals in Chiang Mai.
I think so. There were a lot of medical things. Also, we know about polyclinics as well.
Oh, yeah, polyclinics. Polyclinics are what we'd call in Britain we'd call a GP. In America, I think it might call a family doctor or something like that. A polyclinic is again something you can just drop in. So I've got a bit of a cough. Whatever it might be, I've got a funny rash on my leg. Whatever you might want to see a doctor about.
Things, really.
Minor things. And you can just queue up again. You'll perhaps pay a couple of £100 maybe to see somebody there. The doctor we go and see is a very nice lady doctor. Speaks perfect English.
A lot of Westerners go to her.
A lot of it. She's very popular with Westerners, this lady doctor. Unlike polyclinics, which tend to be open only first thing in the morning and in the evening, because the doctor, I understand the doctors work in the hospitals during the day.
Yeah, some do.
They're moonlighting, as it were, outside the day job. This lady doctor is open all day again. It's very good, and We found her absolutely excellent.
Yes, yes.
She's like a dog with a bone, isn't she?
She
If you've
wants
got a problem, she'll really want to get to the
will
bottom of
find.
it.
Mm.
But
will
she's also
find.
been very good that if you can buy some medication cheaper than getting it from her, she'll tell you. Which I think is really nice.
Yes. You don't feel as though you're ripped off here, actually. Not really, do you?
No, there's a lot of talk, isn't there, about dual pricing. Are we going on to pricing too much here?
No, this is perfect.
Oh, I've got an itchy nose, actually.
Do you want to say that line again?
What was I going to say?
About you
itchy
don't
nose.
think you're ripped off.
Yes.
No, you don't feel as though you're being ripped off here. I mean, there is a phrase in Britain, ripped off Britain, actually, because the prices have gone so
Yes.
sky high.
Yeah.
Hmm.
But and there's talk sometimes about dual pricing. Sometimes people complain about dual pricing. That means one price for Thais and one price for everybody else, for Westerners, what the Thais call Farangs. It goes on a little bit, but we don't really come across it very much, do we?
No. Where
I-
did we come across it? Was it the Queen's Circuit Gardens or something like that?
Yeah, I think there were some public
Public.
gardens, public botanical gardens, huge botanical gardens in
Which
Chiang
are
Mai.
beautiful.
And I think we had to pay 50 baht and the Thais paid 20 baht or something. So we had to pay £1 and the Thais got in for 40p.
Shocking.
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 But
Okay,
I mean, we
think we'll
don't.
cut-
Also, we could mention